Hey Harmonizers, it is vet day, and I just wanted to share a little bit of footage of the girls out in their field before we have a complete makeover day, which I know we're all super excited to see these guys get their feet done and to get their teeth done and vaccines and everything. So it's going to be a pretty big day, but this is the girls. We ended up separating them so they're side by side in the same field. They can still see each other, but starting to separate them because they are ridiculously herd bound to each other, which just makes everything else so much more stressful. And this is kind of a nice way for them to realize that they can make new friends. And it was kind of spurred on because we found out that Asha has lice. So she probably came with the lice, and I don't know, we didn't realize it until this past week. So we ended up putting Asha in the medical bay where these guys were, which meant that we needed to integrate them into herds sooner rather than later. So we decided to do this where we separated the two into the two different spots. And so what surprised me is that Sugar is actually the more herd-bound one than Cookie. So that's Cookie on the right there. She's the one that turns 4 in November. And then Sugar's the one on the left, and she's the one that turns 4 in July. And Sugar, I thought, was kind of the calmer one. Like, she did better on the cross ties and things for her first session and was generally kind of more relaxed looking. But Cookie really surprised me here. So she's actually kind of exploring and going around the field a little bit and starting to walk around and look pretty interested in things. That's Pumpkin that's out in the field with her, who also got her teeth done and gotten a vet assessment done. And then Sugar's on the left there. She's out with Bunny and Dare. So it's very interesting. Things don't always go the way that you think they're going to go. And Cookie's out there totally fine, and Sugar's over here stressing out. So hopefully over the next couple days they'll kind of settle down and they can realize that they can hang out a little bit and they can still touch noses and see each other, but also start to meet new friends and get more comfortable in their space. So for Pumpkin, she did get her lameness exam. If you guys have been following her, you'll know that I noticed she was kind of hitchy when I bought her, but because of her temperament, I bought her anyways. And I forgot to take the video footage before we went out and did the teeth and everything like that, and she got drugged up. So I'll have to kind of tell you about that after she's getting her teeth done. But first, we're going to take a look at the girls, Cookie and Sugar, and their feet. So this is Cookie, who got her feet done first. So you can see how long they are in the toe, their uneven shapes, their angles are completely off, especially from the side there. You can really see just how long those toes are. And then this is Miss Cookie getting her feet done. So because everything was getting done on one day, we had the vets kind of give them some ACE to settle them, and then a little bit of Dorm, which is tranquilizer. And it kind of worked out really, really well because we brought them into the arena, which is a place that they're familiar with because they've had 2 sessions in here already. And we brought Sugar in as well. So they were side by side on the cross ties, and they could just really relax and let the drugs really settle in, which really helped them, because if you give them the drugs and then you do something kind of stressful like teeth first, that can kind of make them a little bit fighty first. So then afterwards, we're still having a whole bunch of other horses get their teeth done. So even Bunny got a little check. That's Khaleesi over there. So we had the vet working on those things, and then we had the farrier doing the feet. And so the farrier got a bunch of really nice, quiet horses to do their feet because everybody was starting to be sedated. And you can see Sugar's in the background there on the cross ties. She has just been drugged and is starting to kind of let the drug sink in and get nice and relaxed. I figured, why make this stressful for them? Their feet are so bad. I wasn't sure if it was going to hurt them to stand on 3 feet. May as well just make them as comfortable as possible and let the farrier do a good job. And then we're going to take a look at Sugar. So this is Sugar, and the little blood spot there is just because she had the IV done for her drugs. And you can see how bad her feet are, especially the right one there. The toe is so long, and again, totally different shapes. which can lead to issues and pain and discomfort. And there's a look at her back, feet, really, really long toes. And then this is a look afterwards on Cookie, who's still feeling pretty darn good. And now she's got feet that look more like hooves. The toes have been cut off. And they're not perfectly the same shape just yet because you can't make too drastic of changes, but they'll definitely be getting a lot better as they get a couple trims under their belt. Then they'll get more and more even in shape now that we've gotten rid of all of kind of that excess. So here's Sugar getting her feet done, and you can see, she's still obviously awake a little bit. And when you're giving a horse tranquilizer to be able to do their feet, it's kind of a fine balance because you don't want them so tranquilized that they're going to fall over standing on 3 legs, but you want them to be relaxed and comfortable. So here she was a little bit unsure getting her feet done, and so she's a little bit kind of fighting it a little bit. We had 2 training sessions before we got to this day, and they were already friendly horses before we got them. It was just that we needed to train them on other skills, and they hadn't had their feet done, so we were worked a little bit on picking up feet and stuff like that. So they haven't had a lot of work done with picking up their feet, so it's still a little bit new and different, and the farm is still pretty new for them, so that's going to be a little bit stressful, and that can cause them to be a little bit more awake off of the tranquilizer. But the nice thing is that now she can kind of relax into it, and then by the time it's teeth time, she can be a little bit more settled. So after they had their hooves done here, they get the front part of the rasping all done, and then afterwards they headed in to get their teeth done and their vaccines done at the same time. And interesting for Sugar, her mouth was pretty good. The vet didn't really have any big comments for her, and her wolf teeth, I believe, didn't need coming out or anything like that. It wasn't anything too big. And Cookie actually had a couple twisted teeth that needed to be grinded down. There's a little look at Pumpkin getting started in there, and this is Asha, I believe, over here getting done. So everybody's feeling pretty good there. That's Pumpkin. So here inside Pumpkin's mouth, she actually had some horrible sharp points. Like, that's a huge hook. There you can see how uneven that is and how pointy it is compared to the other teeth there. I know it's a little bit rocky as he's going through there in terms of, like, it's a little tough to see. So her teeth didn't have any fractures or anything like that, and you can see a bunch of flat teeth. And on the side of her cheek, there was a whole bunch of ulcerations. So you're not going to see, there's a big hook there as well. It's not nice and pink on her cheek. It's actually like very cut looking along her cheek. Like, there's a huge cut mark there on the right side, a big laceration. So really uncomfortable for her. And then in these teeth here, we're taking a look at the teeth going down, and that was one of the twisted teeth from Cookie, the first image that was there. So they're just kind of showing, they look for all the different points and see what exactly the horses need. And you want to see them kind of straight. You don't want to see any cuts or anything like that. You don't want to see any big hooks. And Cookie has the one twisted tooth, so they ended up doing some work there to straighten that up. And it's a good thing we did, because then it means that they were able to get that fixed, so that way they can grow in straight and not have issues anymore. So here's just a little clip of Alicia getting her feet done, and then here's Sugar getting her teeth done, just kind of showing you different clips of different horses getting everything all done. It was a very busy day of work of everybody getting done. So that's Cookie and Sugar side by side. Here's Cookie here, and we're going to see another little look at the twisted tooth. So there you can see it a little bit better there, where these ones are straight, and then you can see kind of that, and it's got some rotting stuff in the center there. So that all got cleaned up, and I'm so glad that everybody got taken care of and can feel a lot better. So for Pumpkin, this is just footage of when we picked her up, because I forgot to film when she got her assessment done. So I noticed when we got her that she kind of had a little bit of a hitch, and I thought it was her right hind. Some of you guys commented on the video that you thought it was the right front, and you guys are right. It is the right front that she's a little bit sore on. The vet basically said that she's still like pretty sound, and it definitely not like dead lame on it. We don't have to stop using her or anything like that. But he thinks it's just because of the trimming job, like her heels are really contracted and very kind of upright. So he thinks that once we get her trimmed better and maybe put front shoes on her. So we've got that booked for in a couple weeks time. So she'll be getting some front shoes and just kind of trying to correct those feet a little bit. So the good news, nothing serious that we shouldn't be able to take care of. And he didn't seem to think that it was going to be a big deal. So anyways, hope you guys enjoyed watching and seeing all the health updates.